Good afternoon, everybody. I'm Myra Ansari here for Wave Now's Ask the Doc. We are talking about migraines today, and I know that this is a topic so many of you are interested in. If you're like me, you suffer from migraines as an adult. I can tell you it kind of hit me when I turned 40, and I've been dealing with it now for a couple of years, and it is absolutely devastating, and it hurts, and it's painful, and until you go through it, you probably don't understand how debilitating migraines can be. And what was interesting to me, because I always thought migraines probably just impact adults because that's when it hit me, but children can also suffer from migraines. So if you can imagine how hard it is for us as adults to have migraines, just think about how painful that is for children. So I was really excited when Norton Children's reached out to me to give us the opportunity to talk with Dr. Elizabeth Dahl. She's a neurologist with Norton Children, specializing in this with children and what she sees. She's joining us today by Zoom to talk about this. And if you have questions for her, please drop them here on our stream, and I will try to get them over to Dr. Dahl. Dr. Dahl, thanks for talking with us. First, how common are migraines in children?
So actually, migraines are quite common in children. Up to 10% of children have migraines. And if you ask adults, most of them will recall that their migraines actually began when they were children or adolescents. So it really does start in kids and sometimes can get worse as you get older.
And do kids suffer the same way adults do? Is it the same type of pain, same type of symptoms, that sort of thing?
So there can be some discrepancies in children. Obviously, the younger the child, the more challenging it can be to kind of uh, establish what the symptoms they're experiencing. So, a young child may not be able to express that they're having pain, but you can kind of infer based on their behavior, if they're going into a dark room, turning off the lights, asking for music to be turned off, and they typically as they get older, they're more able to express the symptoms that they're experiencing.
How young, Dr. Dahl, have you seen maybe your patients or heard of patients, children, having migraines?
So we see it in infants. It's harder to obviously diagnose in that age group, but there have been reports of infants, toddlers. Typically, migraines start in boys a little bit earlier than in girls. So in boys, average age of onset for migraine with aura is about 5 or 6, and then without aura is about 10 or 11. And then in girls, it tends to be a little bit later. But once girls start having migraines, then they start to outpace boys in terms of having migraines, about 3 to 1 in girls compared to boys.
And how do we know, Dr. Dahl, if our kids come up to us and say, because I feel like kids, Mom, I have a stomach ache, Mom, my head hurts, how do you figure out if your child is having a simple headache versus a migraine?
Well, first of all, migraines are quite disabling. Sorry about that. The mailman came.
That's okay.
Migraines can be quite disabling. So, first of all, it's a specific type of headache where you have throbbing head pain. It can be accompanied by light sensitivity, sound sensitivity, nausea, vomiting, and in children, they may complain of more bilateral pain, whereas in adults, it may be more on one side. And so, again, you have to be a good detective in terms of talking to children to try to discern whether this is a, tension type headache, which is more kind of a squeezing pain that tends to be more stress induced and is not that disabling, versus a migraine, which typically will kind of, really put somebody down for the count.
All right. If you have a question for Dr. Dahl, please post it here on our Facebook stream, and I will get that over to her. Dr. Dahl, do we know why we're seeing more children being diagnosed with migraines?
That's a great question. I think that the jury's still out on that. Now, I have some conjectures. I think that probably we're doing a better job of diagnosing migraines and there's greater awareness. Whereas back in the day, it may not have come to medical attention. But I do think that there is, an epidemic of stress, anxiety, depression in children and adolescents, and that can obviously play a role in migraines. It's not necessarily there's not necessarily a direct link, but it definitely can play a role in fueling migraines and so that's something that we're seeing more and more of. Our referrals are crazy right now.
And so if I'm an adult and I have migraines, does that mean my children are going to have migraines? Is heredity a part of this?
Yes. So there does tend to be a familial predisposition to migraines. So if a child has a migraine, chances are that their parents also have migraines, or extended family members. It's actually unusual for me to hear that there's no family history associated with a migraine.
All right, we do have a comment here by Jamie Rowland. She says, my 9-year-old gets headaches. She's on meds, but still gets them. I also have chronic severe migraine syndrome. Can migraines be genetic? Well, we just talked about that, and yeah, I see your comment there, Jamie. I feel you. I understand how hard it must be for you, Jamie, to go through that and then to see your child go through that. So my heart goes out to you, but I'm glad she touched on talking about medication. I always like to be transparent. I went to a neurologist at Norton to help me because I felt like I can't function. I was nauseated. I couldn't see straight. In my job where we're reading prompters, I couldn't focus. It was really getting in the way of day-to-day function. So I finally got on medication to help me, and it's been life-altering. I think when you go through that pain, Dr. Dahl, maybe you can kind of fill in on this. You forget what feeling normal feels like, right? And that's kind of hard for kids.
Yeah. And yeah, I think that you're right in that, I don't think there's enough understanding that migraines can affect children and adolescents. And the earlier you address it, the better. It's exciting that there are kind of a lot of newer treatments that have come down the pipeline. For example, right now we have a drug trial with one of the newer injectable CGRP antagonists that are only FDA approved in adults right now. So we're trying to kind of get some of these newer drugs accessible to children, and we hope that will be available more readily to kids as time passes. We also offer acupuncture. And so there's a lot of medication options, but there's also non-medication options as well. We're also starting to do Botox injections for children.
Can you talk a little bit more about, because I'm sure parents, if medication, putting your child on medication is not the route that you want to go on. This is interesting because you have quite a bit of experience with acupuncture. Does that offer some relief, and is it safe?
So acupuncture, yes, it has been around for thousands of years. It dates back to ancient China and Japan. And, the theory is that you have these energy channels in your body, and when your body is stressed or has a migraine, those channels get blocked. And so the purpose of acupuncture is to kind of help restore the flow of energy through the body and can help relieve migraine. And I've had really good success in using it with kids. And believe it or not, they actually do really well with the needles. I've been really happy with the results I've seen.
So is that something you go, how does a parent explore that option? Is it you go to your pediatrician, you go to a neurologist like you? How do they start that, going down that path of, all right, how do I treat this? And what's the path of finding relief?
So in general, I mean, I would recommend that you go first to your primary care provider and just kind of explain the symptoms that you're experiencing because, migraines affect about 10% of children and adolescents. And so it's quite common. And the pediatrician or family care doctor is familiar with migraines and can provide some education and, treatment there in the office. If the migraine is disabling, then they can certainly make a referral to pediatric neurology, and we're happy to see you in our office and talk about different options. And like I said, I offer a lot of different treatments. I kind of consider migraine to be it's like building a house. So you start with the foundation, which is a lot of the lifestyle factors. That comes down to hydration, nutrition, not skipping meals, stress reduction, exercise, good sleep, etc. And then on top of that, you build the treatments. So you have acute treatments like, ibuprofen, Tylenol. There's medications that are designed more specifically for migraine, like the triptans. And then if children are experiencing headaches, I usually use a cutoff of about once a week or more. At that point, we'll start to talk about whether a child needs migraine prevention.
And Dr. Dahl, I know for adults, sometimes our migraines can prevent us from going to work, being social. You kind of feel like you're getting swallowed in. How do we see it impacting children? I'm assuming it's hard for them to go to school and be participating in things.
Yeah, and so I mean, I think as adults can obviously attest, if you have a migraine, you can't go to work. Well, it's the same for children. If they have a migraine, if they're, you know, if they're having a throbbing, disabling headache and they're vomiting, they're not going to be able to go to school, or they're going to miss school. And so we try to talk about strategies to, treat the headache aggressively and try to come up with a plan to reduce the frequency of those headaches so that they can attend school and that they can thrive and, be engaged with school activities and friends and things like that.
And, for some folks, they may suffer from migraines and they haven't seen a specialist about it yet. And maybe they're finding out my child is starting to develop this. Is there anything over the counter that you suggest that they can take before maybe they start to think, okay, this is pretty serious. I need to see a doctor about this?
Sure. Well, in children, they just recently came out with new recommendations. Ibuprofen is actually the first line, and using an appropriate dose of ibuprofen. Ibuprofen tends to work a little bit better than acetaminophen or Tylenol. Then, if that is not working, then consider something like a triptan. So, for example, rizatriptan is FDA approved in children 6 and older. We use a lot of sumatriptan. There's about 7 triptans on the market. And then again, we have other treatments, but typically ibuprofen and the triptans kind of the mainstay of what we use to treat headaches acutely.
And can you talk about some of the other medications, prescription medications that you've seen success with for treating children?
Sure. So a lot of times when I see a patient, I will, obviously when you're dealing with children, you're also dealing with the family members as well. And we'll talk about, starting with vitamins. There's certain vitamins that can be very helpful for migraine without all the side effects that come with prescription medicines. So for example, magnesium oxide, coenzyme Q10 and riboflavin have a lot of literature support for efficacy. And, if those are not effective, then after that, we can move on to stronger medicines like topiramate, amitriptyline, beta blockers like propranolol. Botox, believe it or not, is actually a really helpful treatment for migraine, and does not have a lot of side effects. So we're hoping to use more and more of that. But we do run into a lot of insurance challenges. Of course, when we have kids and we're using medications that are off label or not approved, it can be challenging to get those approved through insurance. There's a lot of newer devices on the market as well. There's trigeminal nerve stimulator devices. There's a device called a Neurivio, which looks like those old-fashioned iPods that you put on your arm, and it kind of sends a little shockwave through your arm, and it can be very helpful, just as effective as the triptans in some trials for treating migraines. So there's a lot of exciting new medications coming down the pipeline.
And Dr. Dahl, does it mean if you're going to have migraines as children, can you grow out of this phase? Or does it more than likely carry through as an adult?
So again, girls tend to be more affected than boys, number one. I think that the earlier you address the headache and kind of implement strategies to treat it, the better that you'll do in the long run. Because if you kind of let it go untreated for a long time, then it kind of tends to snowball and it becomes harder to break that cycle. So, we do see a lot of kids that kind of outgrow their migraines, or at least learn to live with them and treat them more effectively as time passes.
Okay. Dr. Dahl, I've enjoyed this conversation. Is there anything that I did not ask you that you want folks to know about children suffering with migraines?
Sure. Yeah. At Norton Children's Hospital, we have several child neurologists. We have also a number of nurse practitioners as well. We're happy to see kids in clinic, and I do think that it is nice to have a neurologist with expertise in dealing with children, because again, migraines can manifest a little bit differently in children. For example, we know that colic in babies can be a precursor to migraines later on, or in children that just have episodic or intermittent abdominal pain, that can actually be what's called an abdominal migraine, and they don't necessarily have to have the head pain associated with it. And so it does sometimes take the lens of a child neurologist or an expert in pediatrics to kind of help get to the bottom of what's going on with the child's head pain.
And do you all, I'm sorry, I'm cutting you off right there because you brought up a good point. How do you all diagnose, like, okay, this young boy or girl is suffering from a migraine? Is it questions that you ask? Is it certain testing that you do?
Well, yeah, I was getting ready to address that actually, because, as a neurologist, our goal is to try to kind of, first of all, differentiate between whether this is a primary headache disorder, meaning like a migraine, and that is a clinical diagnosis. So migraine does not require brain MRI picture. It is a clinical diagnosis. Now, if there are red flags that suggest that there is a kind of secondary process going on, we may do further investigations. But migraine is a clinical diagnosis. So if a patient comes in, has had several hours of disabling head pain, throbbing, either unilateral or bilateral pain associated with nausea, vomiting, light sensitivity, sound sensitivity, and relief with rest, that is pretty suggestive of a migraine. But we do have to kind of be careful about not discounting other causes of headaches. And so we do ask questions that help us kind of differentiate between a run-of-the-mill migraine and a different or scarier type of headache.
Okay. Dr. Dahl, thank you so much for your time here for Wave Now's Ask the Doc. I hope that you all got a little something out of this. I know I did. It makes me, just as a parent, take our kids' concerns more seriously. And there's nothing wrong with doing a little digging ourselves and asking our children, okay, what can we do to make life easier? Because I know how painful that this can be. Don't want our kids to go through this. Dr. Dahl, I appreciate your time today. And we will see you again shortly. I'm Myra Ansari with Dr. Elizabeth Dahl from Norton Children's Hospital. Have a wonderful day.
Thank you.
Thank you.